I believe Dr. Van Doren had some opening words before I jump into the presentation.
All right, yeah, that sounds great. So I am Vanessa Van Doren. I just finished internal medicine residency here at Emory. I'm doing a research chief year. And more relevant to tonight, I'm one of the leaders of an advocacy branch of a group called the Churchwell Diversity and Inclusion Collective. So we're a resident-led group, just started our third year. And the group does a whole bunch of different things. We're an affinity group for underrepresented in medicine residents. We do a lot of community facing and service events, and then we advocate for structural changes to our program, hospitals, healthcare system, and ultimately, ideally society to advance health equity. So that's sort of my tie-in to gerrymandering and what we're talking about tonight. So before I get started, I just wanted to thank Rebecca and Surabhi. Am I pronouncing that right? Yeah.
Yes.
Of HSAT for organizing this, and then Fair Count, Geminish, is that right?
Jamanish.
Okay. For running this whole thing and letting the residents join. We really appreciate it. And then Dr. Schmidt for connecting us. So I just wanted to talk, in the 5 minutes or so about why people who work in healthcare should care about redistricting. I think, med school and residency are hard. They're very busy. I think being an attending is probably similar. I haven't done that yet, but it can be really hard to find time for doing anything else. And I think a lot of times we find it hard to justify spending our free time on something when we don't really understand the connection or the purpose or why it's important. So that's just what I want to do. I think we're also very privileged as a group where, physicians are still overwhelmingly white and wealthy. We aren't often as affected by political decisions as people with fewer resources. So we're shielded from it, and it makes us less involved. So, a timely example is the abortion restrictions that just were passed in Texas. If you're wealthy, if you want or need an abortion, you can afford to leave the state and get it. But someone with fewer resources can't get time off, can't get childcare, can't get transportation or lodging, things like that. So, all these things can kind of make physicians and wealthy people and white people a lot more apathetic about political advocacy. I think politics can often feel really removed from our day-to-day lives, what we see in the hospital and clinic. Why should I care about, how the boundaries of our districts are drawn? How does that affect me or my patients? I think that's important to make that connection. So, just a quick kind of informal poll, who here has felt frustrated in the hospital or clinic because what your patient needs, but you can't access it? They can't afford it, or you can't get them connected. Does anybody raise your hand if you feel that way? Or does anybody even just have a quick anecdote about that they're willing to share? I feel like that all the time.
I can share. So my name is Margot. I'm a second year at Morehouse School of Medicine, and I work with our student-run clinic along with Bertha. We're in the same e-board. And working in the clinic, our target population is people without insurance. And so sometimes people have a follow-up appointment scheduled, for example, to review their labs. We'll see that they haven't gotten their labs filled. And that can be frustrating, especially if the last visit, say, for example, their A1C was super high. So that they really do need to get it checked on. But for example, a lot of times the problem is that they don't have transportation. And so we do try to work on getting those resources for them, but small things like that, you can see how basic things get in the way of healthcare. So it can be frustrating.
Yeah, absolutely. I feel the same way. My clinic for the past 3 years has been at Grady, and it's kind of the same thing where basically all the things that we need to help people are policy things, instead of something that we can do one-on-one. And I think doctors and med students we do a great job of one-on-one advocacy for that individual patient in front of us. We care about them. We call charities. We try to connect them to community resources. We try to set up transportation through complicated, systems. But, it often isn't enough, and it doesn't help all the other patients that have the same problem that just aren't lucky enough to have someone trying to help them. And I think it also, it leads to a lot of burnout. It's demoralizing and frustrating and really heartbreaking to watch people get sick and die over and over and over again of preventable, treatable illness. And, you see the solution, there's all this evidence behind it, but you can't do anything to implement it because we don't have a structure that takes care of people. And so I think, the policies, the things that are going to help our patients most are policies, right? They're there's access to healthcare, Medicaid expansion, stuff like that, but it's also minimum wage laws and labor laws and affordable housing and mask mandates and things like that. So basically, we live in a representative democracy where, we don't directly vote to decide which laws pass, but instead those laws are voted on by politicians who are elected officials that are supposed to represent us. And so that's sort of why, if you care about your patients in front of you, you have to care about the policy, and you have to care about who's getting elected, who can be elected to enact that policy, basically. And so, we have different geographic locations in the United States, obviously states and districts and things, and we vote for officials who represent us in these different areas. We have, for Atlanta, we have our mayor and our city council. In Georgia, we have our governor, and then also our US senators and reps. And then within Georgia, we vote on state legislators that represent these different districts. And particularly because in the US, states' rights are so important, a lot of these important decisions are left up to state legislature. And so that kind of, like, all that to say, redistricting is so important because the process by which all of those districts are drawn and the people that we can elect, and then how those people can work together to represent us and take care of us and our patients, that's like what's at stake right now. And it only happens every 10 years. And now is the time that those decisions are being made. And so some, kind of like conclusions or take homes are, as many people have said, the personal is political. Laws lead to social situations that impact our patients' health and lives more than anything we do in the hospital or clinic. And that's an evidence-based thing. That's not even just an anecdote. And those laws are passed by politicians who are supposed to represent us. So, in medicine, if we care about root causes, which we do, that's, kind of like the basis of everything that we do. There's no better way to address root causes of morbidity and mortality than advocating for a fair political system so that we can actually elect politicians that will work for us and our patients, and serve our best interests. And like I said, the census happens once a decade, the districts are drawn once a decade, and those decisions will affect us for the next decade. So this is, a once in a decade opportunity to make sure that we accurately represent our changing political landscape and, the growing diversity of Georgia. And then kind of big picture, finally, I think a huge important antidote to the burnout that so many of us feel in medicine is organizing, working together with each other, with other healthcare workers, with community organizations and our patients to address these root causes that are killing our patients. And I think, we should be leveraging the privilege of our white coats to, kind of tell our patients stories and demand that our politicians do better by them and by us. And I think this is a way that we can make being a doctor and working in a hospital something to be really proud of. So that's it for me. I hope that sort of made that connection a little bit more clear. At least that's how I see it. I'm going to put my email in the chat just in case anyone wants to email me about anything, joining CDIC, other advocacy connections. And then I have to put my 3-month-old to bed. So I'm going to go off camera for a little bit, but I'm really looking forward to hearing everything tonight. And then I know there's a recording. I'm going to circulate that around the residents too. All right. Thank you so much.
Thank you so much for that, Vanessa. So just a quick overview and we'll get started. So I'm going to give an in-depth presentation that sort of walks you through, the census, redistricting, how it's all connected. And then we are going to work on some community maps, which is just one of the ways you can get involved. And I will quickly explain for you all what that looks like too. And it's also something you could finish at another time if you just don't want to put that time into it tonight. So I will go ahead and screen share and get started on the presentation. And Rebecca and Surabhi, if you wouldn't mind, could you keep an eye, wrong thing, on the, let me go to the right window, on the participants just to see if other people join.
Got it.
Thank you. All right, we have the correct one now. All right, so as you all know, as I've been introduced, I'm Jamanish from FairCount. And FairCount is a nonpartisan nonprofit that was founded in 2019 to do work around the census. And we've grown and expanded to do, other civic engagement and participation work, including, voter education and engagement, as well as now redistricting. And then we just keep cycling back into, the next election and the next, census, ACS, whatever comes up next, to make sure people are involved all year round in their political processes. So just right into the 2020 census, as Vanessa just explained a bit, this is something that happens once every 10 years. And what it is just a basic count of everybody who is in the United States on April 1st of each, 10 years. And so this, and despite some challenges to this that we'll talk about in just a second, this is everybody who is in the country, not everybody who is a citizen of the country or is of voting age of the country. It's everybody who is in the country. And it also takes into account people who are, for military reasons or whatever other reason abroad during this time. So it includes US citizens who are not in the country, as well as everybody who is on US soil on this date. And the census, the reason why we're talking about this before we get into redistricting is it's really the basis of everything that redistricting does. It makes redistricting possible. And so as you can see here, a list of just a number of the different programs and things that are affected by census money. This information, this 1.5 trillion annually, comes from the Urban Institute. And so they sort of update that information as of course, the US budget and things change. But essentially, these programs that money is being directed to, those will be the same. And as you can see, there are a lot of different programs here that affect people's ability to access healthcare. And we'll get into this again and when we start talking about redistricting, but ultimately, the census is going to tell us how many people are in these places. And then the districts that are drawn based off of that information will guide the distribution of these resources, as well as allow us to, elect officials that will direct that distribution. So it's very important to be involved in both the census and redistricting. The Urban Institute, the same institute, or the same group that did this study, they estimated that it's over $3,000 in Georgia per person lost every year for each person undercounted in the census. And so that's a massive amount of those resources that are being lost in each community. And we'll come back to those numbers in just a second, getting ahead of myself. The census, another thing it does besides directing all of that distribution of resources, as well as power ultimately, is it also helps inform businesses as well as our government where to build things like grocery stores and hospitals. And of course, those are very, impactful in terms of health, and particularly, in rural Georgia where people don't really have access to either. So it's not just, these government resources that are directed by the census, but it's ultimately all of our corporate resources as well. So now we'll talk just a little bit about hard to count populations. This is a term the Census Bureau uses. Fair Count is not a big fan of the term. It makes it sound like there's something, inherent about these groups of people that make them hard to count, instead of something wrong with the way the outreach is being done. And so there's sort of different ways and different groups of these people that it may be people are hard to contact, or it may be that people are distrustful of the government, various other things that just make that increase the likelihood of an undercount in each of these population groups. And here is just some information about what that undercount really looks like for communities. And again, it's over $3,000 per person in Georgia every year lost for each person undercounted in the census. And as you can see, that really adds up to billions annually lost that goes directly back to those communities. It's not just distributed across the state, it goes directly back to that census tract where you were counted. So it really does matter to be counted. And here are just a number of challenges to the census, a number of things that increase that undercount. It was the first one online ever. And in Georgia, especially rural Georgia, there is not access to broadband internet. People didn't have access to participate in it. The budget for enumerators was cut, meaning that in-person outreach in rural areas wasn't done at the same, degree it had been in the past. And then also these questionnaire assistance centers, that program was cut as well, which were, assistance centers targeted at those rural areas across the country to help people be engaged, to help people fill out their census. Another thing, prison Mandarin, and we'll talk about this. This is something that essentially happens during the census, but is a type of gerrymandering. And so we will jump back into that in just a bit. And then the next thing, the citizenship question, there was the threat that that there could be a citizenship question on the census. It did not end up on the census. It was turned down by the Supreme Court. But there was still that threat. And even after the Supreme Court, turned it down, the administration at the time still was really pushing to try to use what's called citizen voting age population data in one way or another. And what that does, besides persuading people not to fill out the census, not to participate, is it also then does not take into account people who, for whatever reason, are not citizens, as well as children. And so it's great that that data is not being used, and that information wasn't, used in the count. But ultimately, that threat of it still affected the count. And we will talk a little bit more about CVAP data a bit later on with some recent news from the Department of Justice. Good news, but recent. And then, of course, the last thing is just that there was a global pandemic. And so not only were there not enumerators in person, but of course that disrupted everything. All of the mailing, all of the other outreach that could have been done was massively disrupted by a pandemic. And just who cared about the census on April 1st when that was 2 weeks into the first lockdown. So there were a lot of challenges to this census information. And for better or worse, this is the information that will guide all of that resources and all of those other way around, all of those resources and all of that representation for the next 10 years. So now we'll just jump right into redistricting, now that you know where they get that information from that guides redistricting and what some of that impact looks like on the census end. So what is redistricting? And a lot of you may already know this, some of the basics of it. A lot of you may be more familiar with gerrymandering than with redistricting, but redistricting is, the process of redrawing political and electoral boundaries every 10 years after the census to ensure that there's the same number of people in each district. There are different requirements in different states for what that really looks like. In Georgia, we really don't have a lot of language in our state constitution for what it looks like. We only have a couple of requirements, whereas a lot of other states have a lot more rules guiding the process. But ultimately, the lines that are drawn are going to be the lines for the next 10 years. And in Georgia, it is actually our state legislature that has the maps drawn. That's outsourced, but then they vote on the maps. They determine the maps that determine if their district even exists anymore. And so, of course, there's a really big conflict of interest there. And it's also something that just increases the risk for gerrymandering in Georgia. All right, so redistricting versus reapportionment. Reapportionment is just the process of reallocating seats in the US Congress based on population shift. And so Georgia, we didn't gain or lose a seat this year. We did gain a seat in 2010, and that's what allowed us to add the 14th congressional district up in Northwest Georgia. But despite, our population growth this year, we stayed the same number of seats in Congress. All right. And so here are just some of those, besides that congressional level, some of those districts or all of those districts that are impacted by this process. And as you can really see, this affects every part of your life. It's your county commissioners, your school boards, your school districts. It's really all of these districts. And I think we tend to think of the congressional or the state house and Senate, but we don't really think how this process is trickling down, to our judicial districts, to this very local level that really, really can harm or hurt or help communities, depending on how it's done. Okay, so how does it impact me? You may already have an idea of this with that census starter. All of those federal programs, all of that money and all of that representation that, is counted up during the census is directed by redistricting, by the boundaries that are drawn. And of course, this lasts for 10 years. But there are also some other consequences to redistricting and gerrymandering. And one of those things is it affects, how responsive our elected officials are to our needs. And just, we will jump into more of these impacts of gerrymandering in a second, trying not to get ahead of myself again. But ultimately, it's going to determine the distribution of resources and representation. So before we jump into gerrymandering, we'll just go over the timeline for Georgia briefly. So April 30th, that was when the reapportionment data came out. Again, we didn't gain or lose a seat. And then June 15th through August 11th, the state legislature held a series of town halls to take, public input on what they would like to see in the process, and what they would like to see, their communities as, when these lines are drawn, how they would like to see their communities represented in this process. In Georgia, they're not required to take public input, and they're not required to take any more public input. And so, while it's great that we had an opportunity to participate, all of that was done before the census data was even available for people, to have meaningful comments on the changes that have happened to Georgia in the last 10 years. And they were also done before any maps were made publicly available. And the state legislature, or the committees, the two committees that direct this process in Georgia, have made it clear that they don't intend to take more public input when the maps are drawn. So we will get into some ways that we are really trying to push for that not to be the case. But again, this is one of those things that puts us at a great risk for gerrymandering, how much control our state legislature has in this process. Okay, so August 12th, the day after the final hearing, was the day the Census Bureau's raw data came out. And that was data that was, in a format that mapping professionals could use, but people like you and I could not understand. And so there were a number of groups that, went ahead and processed that information so we could start using it, and start drawing, example fair maps that don't take into account things like partisanship. But ultimately, the real data that people can understand and then people can really reflect on the changes in their communities won't be released until September 30th. And so now we are in this period of just waiting to see when this legislative session will be called, where these maps will be voted on. We expect it to be this fall. There's been a number of sort of clues from these committees on when it will be, but we're not exactly certain. But most likely a special session will be called this fall, and the maps will be drawn and voted on. There is some chance that some of these local level maps will be drawn in the regular legislative session in early 2022, but it is, we'll see. But ultimately there are candidate filing deadlines in mid-March. So all of this process really has to be wrapped up by then, so we know even what seats are up for election. Oh. All right, so gerrymandering. Gerrymandering is, basically when this process of redistricting is made to go wrong, and ultimately to benefit a particular party or group. And some of the impacts of gerrymandering, and we'll keep talking about this for the next few minutes, are just that it makes our politicians less responsive to our needs. And it ultimately steals voting power and resources from communities that are targeted in this process. And just, Fair Count is nonpartisan, nonprofit, and just, to make it very clear that both parties do this, and both parties always have and always will. And, regardless of who is doing the gerrymandering, it's not in people's best interest. It doesn't serve people's well-being to have these manipulated boundaries. All right, and so more of those impacts. People lose political power and access to resources. And we will talk, when we talk about specific types of gerrymandering, you'll start to understand what that means to lose political power. But ultimately, it's really challenging this principle of one person, one vote. When districts are gerrymandered, that's not so much the case. People's votes matter differently. And then, of course, resources, and even who is directing those resources. It makes elections less competitive, which of course makes politicians less responsive to our needs. You know, if the way lines are drawn ensures their incumbency, they don't have to cater to, you know, their own party, and definitely not the other party, to stay in power. And so that is one you know, great concern. And then the final item here is that it leads to greater polarization, which is of course a concern right now in our country. All right, so now right into these types of gerrymandering. And there's a number of different ways that this is done. We're going to talk about 3. And this first one is called packing. And so packing is when, you know, a group who's you know, a voter bloc, or a group who's being targeted in this process is packed into one district, as you can see in this image, so that it ensures that they win that one district, but it reduces their voting power in all of the surrounding districts. And you'll see an example in a second that makes it very clear how that can be harmful. But ultimately what that does is it just dilutes voting power. So here on this example, this is a map of the greater Miami area, and the area in green is Florida's 20th congressional district. And the 20th congressional district encompasses the majority of Miami's Black residents. And you can see that these people were all packed in, you know, areas that are not geographically similar, and, you know, may not be similar, you know, in terms of community needs as well. But what this does, you know, go throughout the city and pack everybody into this one district, is it makes it so, you know, the Black vote in these other geographically similar areas, well, there isn't a Black vote. There isn't, Black people do not have the power to elect, you know, as many officials as they could. So that is one way that gerrymandering is done. The next way is cracking, and you will see these two things happening together all the time, packing and cracking. And so cracking is basically the opposite. Cracking is when, you know, the group that is being gerrymandered is split into many districts so that they don't have the power to win, you know, an elected official of their choice in any of those districts. And so, you know, you may see packing happening at the center and then all of this cracking happening around it. Or you may just see cracking like in this image, where ultimately, you know, these lines are drawn to ensure that one party or one group will always win. So for this example, if y'all could just put in the chat where you think this picture was taken. Any guesses, or feel free to unmute yourself. Any guesses where this was taken? We get a lot of Minnesotas, a lot of New Yorks. Oh, I put it at the top. It's taken in California. Thank you, Serby, for playing along. Even though I put it at the top of the slide, mixed up my slides. So this is Watts, a neighborhood in Los Angeles. It's a historically Black neighborhood with a growing Latinx population. And in 2003, this bizarre snowstorm hit the city and particularly affected this neighborhood. And hundreds of people lost their homes and all of their possessions. And when they were looking for help, when they were going from official to official, looking for emergency relief, aid, they kept being bounced to another person with people saying, that's not our district, that's not our responsibility. And the reason why this was is because Watts, the area in green on this map, was split into 3 districts. And so, you know, this one neighborhood, and you can see these tiny little, a matter of blocks, you know, determining what district you're in. That of course makes it confusing and complicated to do things like vote when it's hard to identify what district you're in, but also it makes it very hard to receive aid when communities are having, you know, severe issues like that. And that also, you know, in situations like hurricanes and the pandemic, this cracking will also impact how communities receive aid from those disasters. So in California, they have a redistricting commission, unlike Georgia. And in the 2011 redistricting cycle, members of, people that live in the Watts neighborhood, they went and they testified in front of that redistricting body about the harm that was done back in 2003, almost 10 years before, and how it really, really impacted people's lives, how people lost everything. And luckily they were heard and their neighborhood was put in one district. And so not only can you see here just how it really is negatively impacting people's access to representation as well as people's access to resources, but you can also see here how participating can make a difference in this process and can really be the thing that allows your community to not be hurt as badly in these disasters. So, the final type of gerrymandering we will talk about is called prison mandering. And as you may remember, this was also listed on one of the challenges to the census slides. And so this is something that, essentially happens during the census and then, has its impact through redistricting. And so what prison mandering is when people who are incarcerated are counted as residents of the place where they are incarcerated instead of as residents of, the place where they last lived or the place they call home. A number of states have banned this, I believe 10 of them in time for the 2020 redistricting cycle and 1 in time for 2030. But Georgia is not one of those states. Georgia absolutely has and will continue to prison gerrymander. And ultimately it is our local and state level officials that could make the decision to just not do this practice anymore. And a bit of why we would want, this to end is because all of those resources and representation we've been talking about that come back to the census tract where you are counted in, all of that resources and representation are going, that each incarcerated person gets by being counted are going to the place where they are incarcerated instead of their home community. And of course, we know Black and Brown people are disproportionately incarcerated and targeted. And so that means these Black and Brown resources are going to the surrounding areas of incarceration facilities instead of their home community. And we also know, most people in prisons and jails can't vote, but you still get power from having, from being counted in the census, that how much your vote matters district-wide. It's based on how many people are there. And that goes right back to, what I was talking about with the citizenship question and citizen voting age population data of regardless of whether you have the ability to vote, the fact that you're counted in the census means, your body essentially has political power. But if all of that political power is going to these communities where people can't vote, then it's inflating, the votes of the surrounding area around incarceration facilities and deflating the power of the vote in Black and Brown communities. And in Georgia, a lot of our incarceration facilities, and this is also things like ICE detention centers, are located in rural majority white counties. And so that means Black and Brown power and representation and resources are going to rural white communities, inflating their vote. So that's never a fun one because it's certainly not something we can change in time for this year, but it is a major problem in Georgia and across the nation. So a little bit more on gerrymandering. And we'll go back to what I mentioned about the Department of Justice on this slide. So the Voting Rights Act of 1965 made it illegal to draw districts that intentionally dilute the voting power of a protected minority. And that's that section 2 that you can see on the second slide. And so, or the second bullet point. And so the DOJ last week released a statement, basically sort of clarifying their intention to still enforce this. And with things like, states pushing to use CVAP data instead of census data, and CVAP is that citizen voting age population data, instead of census data to redistrict, because ultimately that would cut undocumented people and other people who are not citizens, as well as children, out from being counted, in terms of representation and power. And so the DOJ made it clear that they would consider that a type of, racial discrimination. And the reason why this was so important that they made this statement is because in 2013, Section 5 of the VRA was struck down by the Supreme Court. And what Section 5 did was it required states with a history of racial discrimination to have their maps looked over by the Department of Justice, and just checked, for that, vote dilution of minority groups before they were approved. And so this, of course, includes states like Georgia and other states across the Southeast. And this is the first redistricting cycle since the 60s that no longer applies. And so it was very good to hear that there is still, there is, the DOJ will still do what they can with the Voting Rights Act to prevent, further vote dilution of minority communities. All right. So I mentioned some of this a bit, who's at risk and why. Some of, as you can see, this is a lot of states across the Southeast, a lot of states who have changing populations as well. And I'll just talk a bit about why Georgia in particular is one of the states at the highest risk. As I've mentioned, it's our state legislature that votes on these maps, and we have single party control, meaning one party, and that is in both the House and the Senate in Georgia, as well as in both redistricting committees, the Senate and the House redistricting committee, meaning one party essentially has control over this entire process. And, with record Black and brown voter turnout in recent elections and, in rural areas as well as cities, there is a renewed interest to steal power from those people and to silence those people's voices. And so, that growing population of Black and brown people in Georgia as well is another thing that puts us at risk, with the census information that has come out so far. And this is with a massive undercount, and undercounts of Black and brown people being some of the largest. Georgia is, maybe 1% away from being a majority minority state. And so, that shift, and if you look at it in your local areas, you can really see how quickly that has happened in 10 years. And so, that growing POC population is another reason why Georgia is at risk for gerrymandering. All right. So now that I've just said a bunch of, sort of depressing, what can I do about it things about redistricting, I'm going to try to convince you all to participate and try to make a difference. And so one thing that you all can do to get involved is make a community map, which is what we will be doing in just a minute. And these community maps essentially show where your community is geographically, and what is important to your community, all of the information that the census doesn't provide, with the intention of those communities of interest not being split apart, not being cracked in the redistricting process. And that's really one of the best ways that you can get involved, as well as, submitting written testimony, or if there's any more opportunities for, in-person testimony, doing that as well. And you may be wondering, will these even be taken into account? Will they be considered? We don't know if they will be taken into account, if they will be considered. Fair Count will be submitting all of the maps that we collect to our state legislatures one way or another. But another big component of why this is important to participate in is there will be litigation after unfair maps are drawn, and things like testimonies and community maps can be used as evidence in litigation to prove that gerrymandering has happened and that it's an illegal type of gerrymandering, because partisan gerrymandering, totally legal. Racial gerrymandering, illegal. And so to prove, and racial gerrymandering can be done under the guise of partisan gerrymandering. So we really need that evidence to prove that they knew the harm they were doing and that it was racial gerrymandering, not partisan gerrymandering, after this process is over, to hopefully, bring some communities back together that will be split up by this process. Some other things you can do, really just make as much noise as you can about this process. Put as much pressure as you can on your local officials and your legislators, to have a fairer process and to have chances for meaningful public input, transparency, language equity. There's all sorts of issues with the process they've provided. And so we can really put a lot of pressure on them to make a fair process, and who knows, it might work. So community mapping, these are just some of the other community mapping programs that you may hear about. Faircount is using Representable, partly because it is very user-friendly. And it includes like a testimony portion as well as a mapping portion that I'll show you in just a second. So it's a very easy tool to use that, again, you're just drawing geographically where your community is on a map to, to make the point of this community should be kept together in this process. So before I show you all quickly how to use Representable, does anybody have any questions about any of that? Let me check the chat.
There is a question in the chat from Dr. Schmidt. There was an article in the AJC this week about Athens and how the college town could be split into 2 different districts. Do you know anything about that?
I would say almost certainly it's split into different districts. The majority of colleges and universities in Georgia are split into 2 or more districts. And 2/3 of Georgia's small to mid-sized cities are also split into 2 or more districts. So that's I am sure what they put in the AJC about that is true. UGA is almost definitely split into 2 districts. And you can imagine how difficult that makes things like voting, if people all having that same address, but living on different sides of the campus, ultimately determining what voter precinct you're voting in. And so you could just be bounced from one to another and not be able to vote. And that's a big concern, as well as, all of the resources and access. Even just being able to access voting is a big concern with how what's called group housing, which is things like colleges and universities and prisons and military bases. It's a census term. But yeah, so that's a big concern, is just people even knowing where they can vote. Are there any other questions?
Can you clarify what the Department of Justice said with things being struck down? I didn't quite get that. And I guess, is that just a virtue of our current administration and how they may be feeling? And could it very well be that the Department of Justice changes their message in future years, depending on whose administration is in at the time?
Yeah, I mean, I think so. I think, the Department of Justice we saw last year was pushing for the citizenship question and pushing for CVAP data to be used to redistrict. And so I do think that is a consequence of, just a different administration being in charge. But yeah, in terms of, long-term, will that just keep flip-flopping what they do? Of course it will. But if we all buy in now and get fair votes, then hopefully we can elect officials that will want us to have a fair vote 10 years from now. I hope that answered your question, Stacy.
Yes, it did. Thank you. I had just one follow-up. You don't have to answer it now, but just how do you stay in this when it seems that the deck might be stacked against, just fair counting and fair votes?
Yep. I mean, I think it's definitely a trickier thing to ask people to be involved in than something like voting or the census, where the ask is fill out the census or vote. And so we're really asking people learn and tell everybody how this will impact you, and then draw a community map. And ultimately hoping that if we get enough of that, if we get enough of these testimonies and these maps, that it will make the difference, next year, the year after, or the year after that, when litigation happens. So I mean, it's just different in terms of what engagement even looks like and how much you can continue to stay engaged. Of course, after you make a map, one thing you can do, and it seems like you are definitely doing this, is just watching the news and making sure you're aware of what all is going on with redistricting in your area. And, just being up to date and knowing if there are going to be any more opportunities for public input. and just, being involved in community groups and nonprofits that are, doing whatever public pressure type campaigns to hopefully create more input. So those are sort of your options, and none of them are an easy fix to the problem.
There's another question in the chat. Who leads the litigation after maps are drawn? Has there been success before in that process?
Yeah, so who leads litigation, we'll end up seeing when it happens. Fair Count doesn't intend to do the litigation, but we are building evidence. But there will be all sorts of groups. Again, these are nonprofits, C3s or C4s as well, that, could be filing these lawsuits. So, I mean, again, you have to stay in tuned with whatever groups are doing this work to see what will happen. Unfortunately, I don't know exactly who will be doing this litigation work down the line, but it will happen. And then, yeah, there has been success. It really is something, and this isn't saying that it's going to fix all the gerrymandering that's going to happen in Georgia, but it could bring some communities back together. So absolutely, there are successes with it. And I don't know yet who will be doing the litigation. All right, well, if that is all the questions, and feel free to just ask more whenever, as well as just, reach out to me if you have anything else I can help to answer. Let me switch my screen to Representable, and I will put that link in the chat as well, for you all to work on. So if you all would like to, how do I open the chat? Bear with me, here we go. If you all would like to click on the link I just put in the chat and sort of follow along while I screen share you through how this works, then I will just quickly show you how to make a community map. All right. So the link that I just dropped in the chat, it will take you to this page. This is Fair Count's Representable Drive, our sort of landing page. Each drive that's created is state specific. So if for some reason you're in another state or want to draw a community map in another state, you can just click on Representable in the corner and go through their general drive. But Fair Count, we are only gathering maps for Georgia. So this first page will just tell you a bit of information about redistricting in the state. Hopefully it is all information I've covered. You can also, if you'd like to see some of the other communities being drawn in your area, you can click on this button and it'll take a second to load, and it will bring you to Georgia. So let me readjust my screen so I can navigate. And so if you just zoom in, you can see all these sort of greenish gray parts of the map, and this is where community maps have been drawn. Where it's darker is where there's overlap, where a bunch of maps have been drawn. And so let's just zoom in to Buena Vista, and we'll just choose a random map to take a look at. And you can see on the side as well, and now it's up here, the name of the map, as well as what drive it's submitted to. And then another thing to note is you can see the testimony somebody wrote for all these different prompts, and you can see the map that they've drawn, but you cannot see the name of the person who submitted it or the address they live at. And that's just something to remember as you're drawing your own maps. That information is private. So once you feel ready to get started, go ahead and click started on the bottom of that first page, and then it'll have you fill out some information about yourself. And again, this information is not going to be publicly available. This is really to verify that you're a real person participating in this process, that you're not spamming the process, or, this is just to verify you're a real person. Fair Count will be submitting these maps to the state legislature, and they will not be able to see that information as well. So just don't worry about where your name and address is going. So then it'll take you to this page that explains a little bit about a community of interest. This is, sort of jargony term, but essentially think through, what are the people you feel community with, and what is that area they are in? And this could be all sorts of different sizes or, things that bind people together. And as you're walking through these prompts in the testimony section, just make each one of them your own and interpret it in terms of, your life and your communities. Because this is all to get the information that we don't have in the data. So write the information you have, the things you're the expert on in your own community and your own life. So once you're ready to start, you can click get started. It'll tell you what a community of interest is again. And then there's just all these different prompts that have lots of examples to help you sort of think through what you want to write in each of these sections. You can write as much or as little as you want. You just need to write something in at least one of these boxes in order to submit the map. And again, just make all of this specific to yourself. And what this section is essentially doing is helping you to start thinking, where is my community on a map? Or what are those things, those places, those people that in the next step I am going to place geographically on a map? So these different sections they have are community activities and services. I would think about things like where I go to the doctor, where I get groceries, where I go to work, where I go to worship, where I go to run or hike, or whatever these sort of services and activities are that are important to me and to my community. That'll be really, really different for every person that does this. So, just make it your own. The next one, cultural or historical interests. This could be so many different things. You could be writing about, the diversity or lack of diversity in your neighborhood, or, whatever this area you're defining as your community is. You could write about, gentrification and change that's happened in your neighborhood in recent years. Whatever cultural or historical interests may mean to you. For me, I haven't lived in my neighborhood long, so I don't feel like I have this, long-term bond to this area, but maybe I would write things about like the historical importance of it. I live 2 blocks up from the house where Malcolm X, not wrong name, that was a bad slip, where MLK was born, and it's still this, I live 2 blocks up from where he's buried and the museum and all of this as well. And so I may talk about that significance of this neighborhood, or I may talk about none of the examples I've just given. So do what you will with it. The next one is economic or environmental interests. This could be things like environmental pollution that are causing, kids to grow up with health problems in your area. This could be about a lack of jobs or transportation in your area. This could be about a ton of opportunities in your area. This, whatever that information is for your community. The next one is community needs and concerns. Some of that may have already come up in your other ones. But here and you don't need to think of what does this have to do with redistricting, but just tell us what are those problems and your concerns. And, please feel free to reach out to me if you'd like to tie it more to redistricting in any way. I'm happy to think through that with you. But again, going back to all those census programs affected, as well as those district levels, this process is determining a lot for your communities. And some people's concerns are going to be very specific, like, I live in a 60% Black area, but my school board only has 1 Black representative, that is very clearly, it's a specific issue and very clearly tied to redistricting. But it also could be something like in South Georgia, people having to go to Jacksonville to go to a hospital. There could be these other large scale issues in your community. Then you can tag your community as all sorts of things, completely optional. And then there is just this last section to write whatever additional information you may want to include that you didn't get to include in the previous sections. So then when you're ready, you'll click next, and then you will name your community. I'm going to name mine Old Fourth Ward just because that's where I live. If you remember, this will be publicly viewable, so don't name it your name or your address, but keep it something a bit more general, like a landmark or your neighborhood or something like that. And so then you click next, and it'll take you to the mapping part where you can just search an address and it'll zoom you right in on the map. At any time, you can search another address at the top and it'll take you there. So you don't have to be dragging around the map so much to look for it. As you can see, these sort of gray areas that highlight when I scroll over them, that is how you're going to click your map together. And these groups, you may be wondering why they're all weird sizes and things. So these are census block groups. So basically, you know, this block has the same population as this block. And if we switch to smaller units, then it's census blocks. So same population, same. And that's why they're all these weird sizes. In rural areas, these are going to be much larger units, and so you may want to use the smaller blocks, whereas I find them very frustrating because I am in Metro Atlanta, so I'm going to stick with the larger ones. Just know that once you start clicking your map together like this, if you want to then switch to another unit size, it's going to erase what you've clicked together. So, you know, think a bit about what's most useful for you before you start clicking. And then to actually draw your map, you're just clicking on these squares and it'll highlight them. And if you click something you don't want, click it again and it goes away. And you're just going to keep doing that until you've incorporated all of the different things you've just talked about in that testimony section, where all those people and places and services and needs are. And this will be, again, as big or as small as your community is. You may also have two very geographically separate communities, in which case feel free to make two different maps. And then one other thing to note is just if you click something completely separate, this warning will pop up saying that you need your full map to be connected, which is, fun fact, one of Georgia's only requirements for redistricting is that one unbroken line for our maps. So that is basically how it goes. When you're done, you go ahead and click save. And then you agree to privacy in terms of use. And just to reiterate, we will be submitting your maps to our state legislature, but they will not see your name or your address. And then woo, it's done. And you have this opportunity to export it in different formats. The PDF will show everything you wrote as well as the map you drew. The GeoJSON is a file type that is used by those, district line drawers to create district lines. So it may not be a format you have use for. At any time, you can log back into the account that you will make and export your map, edit your map, delete your map, whatever you want to do with it. But here it is. Here's what your final thing will look like. You also have some data layers you can look at. The election and demographics are not available yet. We do have a little bit. Population for my map did just pop up. That's new. But the reason this isn't available is because that census data is not available yet. But the data layers, I love this feature. You can see, because you've just drawn a whole map that's not thinking about where your district lines are. And I really want you to not think about where your current boundaries are. Don't think about counties and cities and all of those things. Think about where your community is. But now you can go back and you can see how your community is split. And so you can see, mine is in 2 different Senate districts or a bunch of different House districts. And so that may also just even reframe how you're thinking about the problems in your community and things. But yeah, I think that's a very cool feature to play around with these different data layers. All right, so that is Representable. Does anybody have any questions about anything I've talked about today?
I know that we're a couple minutes over, so if you do have questions, feel free to email them to me or email them directly to Javanish, but I can forward them. I'll put my email in the chat, and I'm happy to forward questions. We really want to encourage everyone to save the link, make maps on your own time. This is going to be so important for us to be able to say, well, you split these key communities that we're part of that have similar needs. If the redistricting process doesn't go the way that we want and isn't keeping our communities together. Thank you so much, Javanish, for joining us today, for giving such a great presentation on redistricting. I think Vanessa dropped off, but thank you to her for connecting everything to healthcare and health equity. Again, if you have any questions, feel free to email anyone in the chat. I'll forward the questions that I can't answer myself.
Yeah, thank you. And just feel free to reach out to me for anything. We also hold weekly mapping sessions virtually. So if you do want to just do this with somebody walking through the process with you, check out our website and feel free to join our Mapping Mondays. Thank you all so much for coming. And thank you, Rebecca and Surabhi, for putting this all together.
Thank you.
Thanks. Have a good night.
Have a good night.